Hello, I'm Matthew Weinstock with a preview of the January issue of Hospitals and Health Networks. The cover story kicks off a year-long series we're doing on the Great Boomer Challenge. The series will examine the nation's 75 million baby boomers and the impact they're going to have on the healthcare system. Here's senior writer Paul Barr, a boomer himself, with a closer look.
The baby boomers are important to healthcare because there are so many of them that are going to be entering the retirement age and acquiring the chronic conditions that are so difficult and costly to care for. They're also a little bit sicker than their parents were because they lived a more active lifestyle. Baby boomers also represent an opportunity for healthcare because they're more receptive to new technology, and there's a lot of that taking place right now in the form of mobile health and telehealth. They also are more receptive to new forms of care that are currently being adopted by the healthcare system. After this initial story, our series will cover 5 other areas: chronic care, the economics of Medicare, new forms of care, the workforce and management issues that are affected by the retiring of the baby boomers, and then innovation in technology and caring for the baby boomers.
Thanks, Paul. Look for continuing coverage of the Boomer Challenge throughout the year in the magazine and online. The January issue also features an interview with the University of Michigan's Keith Kochar, who looked at how emergency departments may hold a key to reducing readmissions. Senior editor Bob Kehoe has the details.
In our interview with Dr. Keith Kochar of the University of Michigan Health System's Department of Emergency Medicine, we discuss a paper he and some of his colleagues authored in Health Affairs. The study found that 17% of older adults who had common operations such as back surgery, hip fracture repair, and coronary artery bypass needed emergency care within a month of their hospital stay. Among those who were readmitted, half were readmitted during an emergency department visit. The researchers reviewed Medicare data from 2005 to 2007 to conduct a national analysis of this issue. They found substantial variability in readmission rates, as much as 4-fold across hospitals. Likewise, the findings indicated opportunities for improving care coordination, patient follow-up, and more. Dr. Kochar discusses what can be gleaned from the research data that might lead to reductions in future readmission rates and cost-saving opportunities. He also examines why the study was an important first step in better understanding readmission rates associated with commonly performed surgical procedures on elderly patients. And this is really important. He pinpoints some of the other areas where future research would likely prove beneficial to hospitals trying to reduce readmission rates. Dr. Kochar believes that hospitals adhering to the same practices they're undertaking to affect their 30-day readmission rates would likely see benefits by focusing on emergency department visits as well. Improving the discharge planning process, for example, could influence how frequently patients may end up requiring an ED visit. He thinks these ED encounters provide an important opportunity for physicians to think about alternatives to rehospitalization.
Rounding out the primary articles in the issue are 2 other timely features. One takes a detailed look at the government's controversial Recovery Audit Contractor program. This story looks at how hospitals are coping with the burden of responding to the many RAC requests they get throughout the year, and it examines the changes that are being discussed both in Washington, D.C. and elsewhere to the program. We also have a story on the hot topic of physician recruitment, and we know that many small hospitals have trouble hiring doctors, but some are finding success by offering extended paid leaves to physicians with a passion for working in medically challenged communities, both at home and abroad. And there's one more thing I'd like to encourage you to take some time with, and that's our revamped website. Our goals in redesigning the site were not just cosmetic, but we also wanted to provide you with a better user experience to make it easier for you to find the information you're looking for. So take a look at the site, take it out for a test drive, and let us know what you think. For HNHN, I'm Matthew Weinstock. Thanks for tuning in.